Joining us once again is Governor Ned Lamont for this special live edition of Face the State on this Thursday night. And Governor, there are being many concerns expressed by dental hygienists. Dozens of emails rather were emailed to us, the exact same email, saying that they are very concerned about offices opening for elective dental procedures in phase one. There have been meetings apparently on this during the week. What do you think about this? They're concerned about opening up.
Well, first of all, remember, dental was always considered an essential, so we never closed that down. But the dentists themselves came forward and said, we want to make sure we save our protective gear for frontline responders in COVID. We'll only open up for emergency procedures. Now they're opening that lens a little bit wider now and taking in more, folks with cavities and other situations. But you're absolutely right, Dennis. We all got together, not me, but our teams got together with the dental, with the hygienists over at Public Health. My understanding is they reached an agreement on what are the right protocols to keep the hygienists safe and yet still able to take care of patients who need help.
Ellen in Manchester.
I think they'll declare that in the next day.
Good enough. Looking forward to that. Thank you, Governor. Ellen in Manchester writes that she reviewed the guidelines for salons and restaurants and other businesses and writes, I did not see any mention of mandating taking temperatures of clients and employees. Don't you think that this would be an added protection for everyone involved? Governor? Well, she goes on to say, the virus is invisible and a temperature check would tell a possibility of the virus present. Why isn't the state implementing this process?
Well, we're thinking about that right now. We were very strict on the salons and the barbershops, limiting the number of people by appointment only, what you have to do to clean between everybody wearing the mask. But the idea of a fever thermometer is something else we ought to think about. We did get about 100,000 of them. We've got them now in our warehouse. We're getting those distributed, and perhaps salons should be on that list. Right now, it's grocery stores, health, nursing, all the places where you may have people back and forth.
We have two questions from viewers in their 60s. Cheryl in Enfield writes, Governor Lamont keeps conveying if you are 65 to stay home. I am over 60 and still need to work. Will unemployment be available to me if employers no longer want to hire me because of Governor Lamont's request citing older workers? And Josie wants to ask you if workers over the age of 65 will be able to return to work during phase two.
I don't believe people over the age of 65 will be able to return to work in phase two. We are the most vulnerable population out there, and I'm afraid we've got to be very careful a little longer than that. If you're over 65 or you have pre-existing conditions, stay home, and unemployment compensation will be there for you.
Mike Pohl reached out to us about people with substance abuse problems. He says, quote, almost all members of substance abuse recovery programs have been meeting online. We are being patient and appreciate you keeping us safe. It's really important that we return to meetings at some point, but we will need PPE for people who can't afford it. Is there any way that you can help with this? And will there be any guidance on how to come back together in meetings to support our recovery?
Yeah, Mike, we'll get you those surgical masks if you can't find them yourself. I know how important the face-to-face contact is for that community, and we're going to make that happen.
Thank you. Welcome back to Face the State with Governor Ned Lamont. And Governor, I wanted to ask you a little bit about testing. One of your goals when the pandemic first broke out was to increase the amount of testing going on in our state. I know that you were tested this week. Tell us about that.
I had held off because up until very recently, we were trying to expand our testing, and only people who are symptomatic we recommended be tested. In the last week or so, Dennis, we have more capacity. I've got to get more people to be willing to go get tested. You can go to that drive-through test in New Haven, get an appointment anytime and go. And it's important now. I encourage people to get tested, symptomatic or non-symptomatic. So I went and got myself tested, and thankfully I was okay. And it's a nice sense of relief. It's a good thing to do.
Absolutely. Well, we're thankful that you're healthy. What you're saying is there are plenty of tests out there, because I know Kara and I took the antibody test. We chose not to do the COVID-19 test because we didn't want to take a test away from someone who needed it, like a first responder or a doctor or nurse or something like that. But you're saying there are plenty out there right now.
Yeah, we've gone from 15,000 tests to 30,000 tests a week to 45,000 tests a week. We're ramping up. We can test everybody in the nursing homes, symptomatic, asymptomatic. other first responders, going to the correctional facilities, going to those communities, underserved communities where people tend to be closer together. We're opening up 2 new testing facilities, CVS facilities in North Hartford over the next couple of days, making it easier for people to get tested. Keep them safe, their families safe, and their communities safe.
As you know, a new poll came out recently that said that 78% of the people in Connecticut think you're doing a great job at handling the coronavirus crisis in our state. What is the most difficult thing about being governor during this pandemic?
I think you don't see it. So early on, it was over in Wuhan, and then it was over in Seattle. And why are we overreacting to something I can't see? Now we're on the back end of it, and I've got to continue to keep people disciplined. Every day is changing, as I said before. So what I try to do is keep the focus. Just because we're allowing a little outdoor eating and allowing you to go to a barber shop under certain circumstances, there's no reason to take your eye off the ball. And if we're serious about this, we are going to get through it a lot faster and a lot cleaner.
Governor Ned Lamont, we thank you so much for your time tonight, for your insight, and for your help on this. Best of luck to you and your family. We hope you can join us next week because, of course, the state reopens Wednesday. So we're going to have lots of questions to see how it goes. But I hope it goes off without a glitch next week. Thanks, Governor.
Thank you, Dennis. Nice to see you, everybody.